Breaking, Britain's 999 system just recorded its worst week in history, and what's causing it will shock you. In the last 24 hours alone, over 5,700 emergency calls were rerouted. 61 emergency zones downgraded. Response times in some areas hit nearly triple the national target. But here's what the government isn't telling you. It's not just about staffing shortages, it's about paramedics who are now afraid to do their jobs. If you want the full story the mainstream outlets won't cover, hit subscribe right now. We're tracking this crisis in real time, and you need to see what happens next. According to new analysis, over 40,000 qualified nurses walked away from NHS employment in the last year. That's 11.5% of the entire workforce gone. But the real emergency isn't in the hospitals anymore. It's on the streets. Across England, ambulance crews are requesting police backup for calls that should never need it. They're citing threats, harassment, and crowds blocking emergency vehicles from reaching patients. In South Manchester, a paramedic crew responding to a chest pain call was stalled behind a hostile crowd outside a disputed housing block. Residents refused to move, even with sirens blaring. By the time police arrived, neighbours had already moved the patient themselves. A dangerous intervention that should never have happened. 2 hours later in East London, another crew was blocked while trying to reach a stabbing victim. Bystanders filmed, shouted, and refused to clear the path. The dispatcher logged 2 words that should be rare: "Scene unsafe." But those words are now appearing in reports across the country with alarming frequency. An internal NHS dashboard flagged something unprecedented: a nationwide spike in obstructed access incidents, nearly triple the weekly average. And these incidents aren't random. They cluster around the same neighbourhoods repeatedly. Areas already strained by overcrowding, rising tensions, and breakdowns in social order. In Birmingham, body cam footage shows a paramedic physically forced back into his ambulance by a surrounding crowd. He wasn't treating anyone. He was retreating. In Bradford, a mental health response team was hit by thrown objects. They waited for backup while the patient deteriorated. In Leicester, a crew sheltered inside their ambulance for 10 minutes before police could escort them out. Emergency work has always relied on one fundamental assumption: the public will let you do your job. But in neighbourhoods stretched by friction and disorder, that assumption is collapsing. One senior dispatcher in the West Midlands said it plainly: half our incidents aren't medical emergencies anymore. They're security risks with medical symptoms attached. Inside the London Emergency Coordination Centre, operators now update risk assessments minute by minute. Routes that were standard for years are suddenly classified as unsafe. And in parts of East London, crews are using a phrase previously reserved for riots and terror incidents: hostile perimeter. This isn't about isolated confrontations. It's about a pattern that's hardening nationwide. At 11:42 yesterday morning, a coordination call between NHS, police and council officials in Greater Manchester ended abruptly. 2 separate incidents broke out during the meeting. Both involved crews prevented from exiting their vehicles. Command staff scrambled to reroute resources just to keep the system from collapsing in real time. An internal monitoring dashboard flashed red 3 times. Not because call volume was high, but because response capacity dropped below safe operational thresholds. One region saw medics refuse to enter a residential block without police backup after receiving threats. Police arrived 20 minutes late because they were stretched across 3 other incidents in the same district. A leaked internal briefing used a phrase you'll never hear from government officials: compounded degradation. In simpler terms, every hour of disruption makes the next hour worse. One operations manager, after a 17-hour shift, put it bluntly: "We're patching holes faster than we can count them. Sooner or later, there won't be enough hands left." Inside Westminster, the official line remains confident. The system is responding. Resources are being deployed. But speak to anyone actually running emergency operations and you'll hear a very different reality. Senior officials privately admit what they won't say publicly: environmental volatility linked to rapid demographic shifts has overwhelmed service routes in 5 major cities. An internal Home Office analysis recommended rapid reassessment of neighbourhood risk zones and additional protection for emergency workers. None of those recommendations appeared in government statements. Instead, spokespersons repeat the same line: Britain's emergency infrastructure remains resilient. Resilient isn't the word used inside operations rooms. Strained, unpredictable, unsustainable. Those are the words appearing in actual reports. Several advisors pushed for the Prime Minister to address the nation at the height of the disruption. He declined, worried that acknowledging the scale would invite questions the government isn't prepared to answer. Questions like, Why did emergency services spend the past year warning about rising operational risks that were repeatedly ignored? Why are frontline staff reporting safety concerns that leadership dismisses as temporary strain? And why is the government insisting the system is stable when those running it describe the situation as hours away from structural breach? Here's the truth Westminster won't say out loud. This isn't a staffing dispute. It's a public order crisis wearing a medical uniform. When paramedics start weighing their own safety before the public's, when dispatchers hesitate because they don't know what environment they're sending teams into, that's when a national emergency system enters existential danger. The mainstream media will tell you about waiting lists and budget cuts. They won't tell you about the streets where ambulances now hesitate to go. They won't connect the dots between rapid demographic change, strained communities, and the breakdown of the social contract that emergency services depend on. But the people living this reality know exactly what's happening. So here's the question I need you to answer honestly in the comments right now. Do you feel safe calling 999 in your area anymore? Comment yes if you trust the system. Comment no if you've lost faith. And if you think this crisis is being covered up, comment share, so we know how many people are demanding the truth, because your voice matters more than any government press release. Stability doesn't vanish overnight. It erodes slowly through moments exactly like these. A country cannot function when emergency workers feel unsafe, communities feel unheard, and leaders seem more focused on narrative than reality. For weeks, officials spoke in rehearsed reassurance. But everyone watching knows what's really happening. The walkouts may end, the reports may fade, but the warning they delivered will not. Because once a system built on constant readiness begins to hesitate, once the assumption of safe access starts to break down, the entire country steps onto uncertain ground. If you want continued coverage that refuses to look away, that connects the headlines to the reality on your street, here's what you need to do. Subscribe to this channel right now. We're following every development the mainstream media won't touch. Hit the like button to break through the algorithm and make sure this reaches people who need to see it. And share this video with someone who still thinks everything is fine, because the truth spreads faster than official statements. We'll be here, tracking this crisis as it unfolds. Stay safe, stay alert, and stay tuned. The next update drops soon.